Thank you very much for the nice introduction, Mr. Chairman. Ladies and gentlemen, good morning. So now we are switching gears to cardiology. The objective of the presentation starts with fasting from dawn to dusk in the holy month of Ramadan for healthy adult Muslims has been ordained, and physically sick Muslims are exempted from it. However, many Muslims with mild to moderate disease, such as hypertension and other medical conditions, do want to fast. So the purpose of this presentation is to make some recommendations as to how they can fast safely in light of research on fasting. Now I will start briefly with what is fasting in different religions. In Islam, we know that this fasting is mainly ordered during Ramadan. So Ramadan is 29 to 30 days obligatory to fast for those who can fast. There is no restriction for taking medications when you are not fasting in Islam. In Christianity, to make a long story short, also, there is no restriction for taking medications when you are not fasting, regardless of the time and regardless of the reason you are fasting for. In Judaism, it's the same, regardless of the reason for fasting or the time of fasting, medications are not restricted. In Hindu, again, there is fasting, and again, they do not advise against taking medications during those fasting days. In Buddhism, it is a little bit different, because in Buddhism and in Sikhism, these two religions, they use fasting as a remedy, as treatment. So that's why they do not recommend taking any medications during that time, because they consider it as remedy or treatment. And finally, Baha'ism, and it's in this type of religion, again, they advise that you can take medications while fasting. So what are the benefits of fasting? It stimulates fat burning, it improves energy levels, it reduces inflammation, it takes stress of the digestive system, stimulates cellular autophagy, it improves genetic repair mechanisms, it stimulates the development of stem cells, improves insulin sensitivity, reduces chronic disease risk, improves relationship with food, enhances mental health and spiritual growth, and fine-tuned intuition. So there are so many benefits with fasting. There are some physiological effects you need to know, and these physiological effects affect all systems of the body: the caloric intake, the fluid and water intake, effects on the digestive system, kidney, endocrine, lipid metabolism, respiratory system, and neurological system. For carbohydrate metabolism, usually the glucose will drop. It can reach up to 60 milligrams at the end of fasting immediately before iftar. This is because serum insulin decreases and glucagon and growth hormone increases due to number one. So that's why in some patients, especially at the last 10 days of Ramadan, you will notice that before iftar, their glucose level might go a little bit high because of that. So this increases the sympathetic activity, increases the liver cyclic AMP, and slight decrease in the first week, then normalizes by day 20, and some rise in the last week. And of course, increase in the gluconeogenesis in the liver. On the lipid, decrease in both total cholesterol and triglycerides in the first few days, then rise to pre-fasting levels, increase in HDL, and effects are variable according to quality and quantity of food consumed at iftar and suhoor. Now, there are some people who are exempted from fasting, and this is by religion, this is by Quran: physically sick, travelers on a long journey, women during menstruation, pregnant and lactating women, and of course, prepubertal children. There are patients who should not fast, And unfortunately, we don't have any guidelines, but we have consensus from different societies in different countries that these categories of patients should not fast during Ramadan. Diabetes type 1, or insulin-dependent diabetes to be exact, chronic renal failure, especially those with renal transplants, severe cardiac and pulmonary conditions, and we will go in details for that, GI bleeding and acute ulcers, severe epilepsy, and severe migraines. General advice to those who will fast. You should consult a Muslim doctor. And by Muslim here, we mean it doesn't have to be a Muslim doctor, but at least someone who understands that why you are fasting and how can he help you during these days of fasting. Practice fasting in Sha'ban if you can. With the approval of physicians, switch to either long-acting or twice daily medications if you are taking the medications more frequently. Elderly patients on NSAIDs should have frequent monitoring of renal functions or try to minimize the use of the medicine during fasting. And anticoagulants and anti-epileptic medications should be given at night. Now, this is a rather busy slide, but just to brief you, here we are trying to risk categorize the patients and see whether, first of all, they are low to moderate risk, as you see on the green on the right, or yellow, which is high risk in the middle, or very high risk, which is red on the left. Now, those with very high risk on the left, they must not fast. Those with low to moderate risk on the right, which is green, they can fast. Now, those in the yellow in the middle should be evaluated individually and see whether they are able to fast or not. Based on what? Based on their prior medical history, based on the type of medications they are taking, based on their pre-fasting clinical and medical condition, and so on. So risk assessment for those patients is very important. So as an example, for the moderate and high risk, check if the patient is aware of the health consequences of Ramadan fasting. And this is very important. Patients should be aware that they will suffer some dehydration. They might suffer some hypotension. They might have long fasting hours, more than 14 to 16 hours in some countries. All this has to be taken into consideration when you are discussing fasting with patients with very high risk that are insisting to fast, or high risk that can fast. The low to moderate risk, they need less discussion, because usually they have conditions that are tolerated during Ramadan. So, what are the cardiac conditions that prevent someone from fasting? It's advanced heart failure, grade 3 or 4, and severe pulmonary hypertension. So patients with these conditions should not be allowed to fast. On the other hand, the low and moderate risk patients are stable hypertension, stable angina, stable non-severe heart failure with ejection fraction more than 35%, or those with preserved ejection fraction, implantable loop recorders, permanent pacemakers or dual chamber pacemakers, mild and moderate valvular disease, supraventricular tachycardias, and those with mild and moderate pulmonary hypertension. Now, those who should not fast, and this is a tough group of patients, because here you will have to argue against fasting and they will argue with fasting. Poorly controlled hypertension, recently acute coronary syndromes and myocardial infarction less than 6 weeks, hypertrophic cardiomyopathy with obstruction, severe valvular disease, severe heart failure without advanced features, poorly controlled arrhythmias, high risk of fatal arrhythmias such as arrhythmogenic right ventricular dysplasia, and implantable cardioverter defibrillators and resynchronization therapy. What about the medications? We know that we have many groups of medications that we use in cardiology and in internal medicine as well for different reasons. For example, ACE inhibitors, they are used for hypertension and heart failure as an example. Now, we know that there might be fasting associated dehydration. So you have to tell your patient there might be a little bit of dehydration. So they should hydrate themselves very well during while they are not fasting, or between fasting and suhoor. Between iftar and suhoor. Now, the problem with dehydration is that it might induce acute kidney injury. So you have to be very careful with that, especially if patients have borderline renal functions. And it can sometimes cause some electrolyte disturbance, such as hyperkalemia. Antiplatelets. Patients with recent coronary stent implantation with less than 6 months should be advised against fasting, if you can. Now, those who are taking medications twice daily, such as Brilinta, they should take the medicine immediately after or when they go for iftar and at suhoor. Preferably, they do not fast more than 12 to 14 hours if possible. If they are fasting more than that, you might consider switching them to something which is taken once daily, or advise them again against fasting. Antiarrhythmic drugs, again, dehydration might promote toxicity, such as for medicines such as amiodarone, flecainide, and sotalol. Beta blockers can be taken safely, but again, if they stop them, it might worsen angina or decompensated heart failure, or might promote for frequent arrhythmia. Calcium channel blockers, again, they cause hypotension and can induce hypotension during fasting. Medication non-compliance may result in worsening angina, more frequent arrhythmias, and uncontrolled hypertension. Cardiac glycosides, if acute kidney injury happen, it causes toxicity of those medications, such as digoxin. Direct oral anticoagulants, as we mentioned, they are safe to be used during Ramadan, between iftar and suhoor, preferably to switch the patients to a once daily regimen if they are taken twice, so preferably not to exceed 12 to 14 hours between both doses, if you are using apixaban, for example. Immunosuppressant drugs, usually patients who are taking immunosuppressants are advised totally against fasting, because dehydration might promote acute kidney injury, and we don't want that to happen to those patients. Medication non-compliance may also result in organ rejection and death. Loop diuretics, some patients refrain from taking them, and some doctors advise against taking them during Ramadan. Well, they can be taken, but you have to pay attention to the hydration condition of the patients. Mineralocorticoids, same thing. Not only that, but with dehydration, it might cause hyperkalemia. Phosphodiesterase inhibitors might worsen fasting hypertension. Prostanoids, again, they cause hypotension, and they are usually used for patients with moderate to severe pulmonary hypertension, and this category of patient is advised against fasting. Statins can be used safely, but again, dehydration can promote for toxicity. Dapagliflozin is a safe medicine to be used, but again, be careful with the dehydration. Soluble gluconate cyclase inhibitors can be used, but they might worsen hypotension. And finally, vasodilating drugs such as nitrates might worsen hypotension and cause dizziness and loss of consciousness in some patients. This is a trial that was done in England, and I'm showing it just as an example that fasting during Ramadan is safe for patients for both systolic and diastolic hypertension, as an example of a medical condition, of a cardiac medical condition during Ramadan. It was found that it is safe compared to placebo for both systolic and diastolic hypertension for those patients to fast and take their medications. So this one is for systolic blood pressure, and this one is for diastolic blood pressure. Now, is there a role of a pharmacist during Ramadan? Yes, definitely. Pharmacists, they have a big role to play in helping Muslims adjust medications safely during Ramadan, and to identify anyone who cannot safely do it. Recent research from Australia found that pharmacists are generally willing to counsel patients during Ramadan, but tend to perceive that there is little need for intervention unless directly asked for. In a predominantly Muslim country such as Egypt, by comparison, most pharmacists adjust medications during Ramadan including the frequency, the dose, the dosage form, and the medication itself sometimes, which is least common. That said, research in other predominantly Muslim countries such as Qatar and Pakistan has shown that pharmacists and physicians with a good knowledge of Islam still have knowledge gaps between how to adjust medications safely during Ramadan. In other words, there is plenty of opportunity to support Muslim patients during Ramadan, but we all have a lot to learn about how to do that safely. So, in conclusion, ladies and gentlemen, Mr. Chairman, the literature on Ramadan fasting in patients with cardiovascular disease is limited. We need to highlight the important role of healthcare professionals play in risk assessment, providing advice and education, encouraging medication compliance and monitoring to able patients who were safe to do so to fulfill their religious obligation while minimizing the potential for harm. Patients with cardiovascular disease often have non-cardiac comorbidities. Our recommendations should be used in combination with those for Ramadan fasting in non-cardiac conditions such as chronic kidney disease, diabetes, and epilepsy. There is a strong need for patients and healthcare professionals and religious community leaders to encourage with each other and discuss their contemporary medical issues. Further studies are needed to explore gaps in knowledge around fasting and to help refine current recommendations. And this is a suggested pre- and post-Ramadan checklist for reviewing patients with cardiovascular conditions. So you establish patient background, you check the patient history, the symptoms, the smoking status, and the cardiac condition and medications. You review, you have to request recent investigations, probably within the last month, or if not done, then you have to do recent ones. Risk stratify your patient whether they can fast or not, or they have other comorbidities and whether or not they are taking other medications. And as a general Ramadan advice, healthy diet and fluid intake, smoking breaks fasting, so opportunity for smoking cessation, terminate fast if feeding unwell, intramuscular injections, and with some preservation, sublingual medications do not break Ramadan fasting. And then after Ramadan, you have to review your patient, explore experience of Ramadan with the patient fasting to guide further fasting in the future. And you should also check for any symptoms and status change during Ramadan. With this, I conclude my presentation. Thank you very much.